Hello, everybody, and welcome to this town hall session on the Palliative Medicine for Healthcare Professionals, MSc. You're all extremely welcome, and I hope that over the next half an hour or so, I will be able to go through some of the aspects of the programme. That may answer some of your questions, but do please use the chat function or the Q&A function on this webinar to be able to ask your questions. We are recording the webinar so that this would be available for you to access afterwards, and for those of you who might be accessing it separately, then again, welcome very much and thank you very much for joining us. I'm hoping that the slides are going to advance. So the question very much is, why do this programme? What is it about palliative care for healthcare professionals that has attracted you? And you're very likely to be working in a setting in healthcare where you are delivering palliative care, whether that's as a specialist or whether that's in part of a generalist role. You'll be seeing patients who are facing a life-limiting illness. They're actually got to navigate a world where their expectations of life will be different, their expectations of prognosis will be different. They may have families, they may be on their own, they may have disability, they may be children, they may have children of their own. But there's a unique set of circumstances when actually the existential part of illness takes over. And what our programme hopes to do is to not only equip you with the skills to continue to deliver palliative care, which you all will already be doing, but also to understand the evidence behind some of the interventions that we use. The global need for palliative care remains immense. There are far more people in need of palliative care than those who are equipped to deliver it. So anything that we can do to help that delivery is important, and to share in these skills. This is one of the things about this programme. Our intention for you is that you feel confident enough to share these skills. There is still an enormous inequity in access to pain relief across the world with strong opioids. And the big figures are 40 million people in need of palliative care. 78% of people live in low middle income countries. Worldwide, 14% of people who need palliative care currently receive it. This is immense. And with the development of assisted dying legal issues around the world, some countries have got assisted dying policies already in place, others are exploring it. The need for accessible, equitable palliative care for the population remains of immense importance. And around the world, it's at increasingly diverse stages of development as a discipline, as a core part of healthcare, as a specialty, as a research and evidence base. And actually, we could argue that it needs to be part of just general life and living. Our communities need to think about how we are supporting those people amongst us who have got a life-limiting illness, who will take that last breath sooner than they had anticipated. So palliative care really is everybody's business. The Cardiff programme started as a diploma, postgraduate diploma, in August 1989. And it was the first of its kind, and it was designed to enable people to study in addition to doing the day job. So the anticipation was that people would be practicing palliative care. At that point in the UK and around the world, very few people had it as a specialty, as established specialty. It had only just become a specialty in the UK, but they were able to learn the skills, but practice them as they were learning them. And since that time, we've developed it's become multi-professional. It has always been international. Paediatric palliative care component was incorporated, and of course the dissertation stage, the MSc, was incorporated. The most recent big redesign was in 2017, when we added to the curriculum leadership and team working and quality improvement as an option, particularly for the dissertation stage, as Many services at this point are in existence, but actually developing those quality services, those quality processes, still need attention. And if you join us in September of this year, you're joining a network of over 3,000 students internationally, and your peers on the course will be some of your strongest supports. Our vision and our objective remains. We are aiming to improving patient care by facilitating accessible education. And we want to support our colleagues and ourselves to develop, share and extend knowledge, understanding and application of evidence-based best practice and governance frameworks in palliative care appropriate to their professional setting. So our international expertise is really important. The framework of what we deliver will be the same, but actually how it's implemented will depend on the setting in which you work. And if you are joining the course from a low middle income country without access to morphine, for example, we have designed the assessments in such a way that you will not be penalised if you're not able to say that I would give X amount of milligrams of morphine, but tell us how you would manage, for example, somebody's cancer pain. And the bottom line to all of this, the question to ask yourself as you start studying with us is, how can I improve the quality of the palliative care my patients receive? And that will be your own activities, that might be the rest of your team's activities, that might be the rest of your organisation's activities. We are a multi-professional team of clinicians and researchers, doctors and nurses, and we have all studied together and we form a very strong, cohesive academic team, well supported by our administrative staff. We fall within the Centre for Medical Education. I'm the Programme Director. I'm also a module lead and work with my colleagues as module lead. We also have honorary tutors who are part of the module faculty, and then of course yourselves. And we learn from each other. We're all working clinically, you are working clinically. We're trying to produce this really collaborative style of professional development. Things are changing all the time. How we deliver the course is with induction days at the start of each year. These are face-to-face. I'll talk about those in a moment. We have modular content, we have discussion boards, and we develop really a strong ethos on those discussion boards of this community of practice. There are online tutorials, there's formative and summative assessments, of course there are, it's a university award, but we also have a very strong student staff panel connection and process, just so that if we need to stop doing things or change how we do things, we can do that quickly. The real emphasis on developing an online community, which is where the days at the start of each academic year are so important. Each of the years of the Masters has 3 20-credit modules in Year 1 and Year 2. And some people decide at the end of Year 2 that that's enough. They won't go on and do that third year, which is the dissertation year. But for others, it's very unpredictable. You might start expecting to stop at the end of Year 2, but actually you might well go on and do that third year. And we encourage people to do the third year because it's learning very definitely transferable skills. You have to pass the modules in Year 1 in order to progress to Year 2. There's a lot of feedback as the course goes along, but the level of the course is the same throughout. Just the assessment at the end of Year 3 is one assessment, a 20,000-word dissertation following your project work, whereas the other years are 20-credit module years. So why do we bring people to Cardiff and urge people, if they can, to come to Cardiff for 3 days at the start of Year 1 and 2 and 5 days at the start of Year 3? This is because we know that building the community of practice, community of learning, is really enhanced if you've met people face to face. At the start of Year 1, we have an advanced communication skills course, which is different to any other programme that you might have been on and has very developmental feedback applicable across all settings. Year 2 is about teamworking and leadership communication skills. Again, things which are much better, much more effective to be practiced face-to-face and to be discussed face-to-face. We also talk about research skills, QI skills, teaching techniques, a lot of transferable skills, ethics, law, challenging complex cases. And then at the start of year 3, we have 5 days of what's effectively a retreat where methodologies for research and QI are explored in workshops. We have library sessions, we have literature searching sessions, with the aim that at the end of those 5 days at year 3, your project is nearly ready to go. And we found that that really helps year 3 to go smoothly. So we know that it's difficult to take time away from the team, but we have designed these face-to-face days to include things which we hope that you will be excited about, to go back to the team, to your team, and to share that knowledge to help develop the team. If they have been able to keep the service going while you have been at these face-to-face days, then we can share that knowledge. In a sense, we can repay that amount of flexibility. We know at the moment that the dates for September 2026 have been made, and they will be Tuesday, Wednesday, Thursday in Cardiff, September the 15th, 16th and 17th. If you already know that there might be an issue but you still want to study the programme, then do please get in touch with us, and particularly get in touch with me personally on email, and we can talk that through and come to an arrangement. Because of the really interactive nature of the sessions at the face-to-face block, if we do record the sessions, they don't always translate well, because there is a lot of discussion and there is a lot of interactivity between tables, between groups, between people. So the hybrid delivery does not work effectively for these sessions. But if in doubt, please drop me an email and we can talk about things. So in year 1, you cover core frameworks and pain management, including communication skills, symptom management for the other symptoms, and bringing it together in care in the last year of life. So really a comprehensive collection of skills, being curious about the evidence, critically appraising the evidence on which you base your practice. And as I say, that if you decided to exit at that point of the course, you would have a postgraduate certificate. There is a prize at the end of year 1 for the student who has the highest mark at that point, and that's the Andy Fowle Award. And that's an award that was developed as a result of one of our colleagues in Wales, who really set up the quality standards for palliative care in Wales. In year 2 starts with a choice. So we teach paediatric palliative care and adult palliative care together for all the modules apart from this one module, because it's the ethics, legal and complex care challenges, and because of consent issues, age, etc. That's the one module where we have divided the group. So you would choose whether to follow the adult or the paediatric option. The assessments are exactly the same. So the difference is in some of the learning material and, of course, some of the application of it, but the assessments are exactly the same. Then Module 5 is palliative care in the workplace, where we think about teams and we think about leadership, and Module 6 is around research and QI. The formative assessments are assessments where there is no mark given, but there is a lot of feedback given to help you develop your ideas. And there are a variety of computer-marked quizzes, discussion boards, case notes, project plans, and we really encourage you to engage with these, just because it shows demonstration of interaction with the learning material, but also it gives a chance for feedback. And the summative assessments are a variety throughout the modules. There are some critical reflections, all of which need reflective practice. There are some recorded presentations. There's a poster, blog discussions in smaller groups where you're learning from each other, opinion pieces which can actually vary, or any of these can in fact be submitted for publication elsewhere. So again, we have designed what we would call endurable assessments, which show transferable skills. Okay. But at the bottom line of all of these is actually designing assessments where the patient remains at the heart of the education process. And that's how the course has been designed, really. And for us as learners and for us as educators, it's how will what I'm learning about benefit the patients that I serve? How would the patients know it's made a difference? How will I know it's made a difference? How will my colleagues know it's made a difference? What will be done differently as a result of reading that paper, attending that tutorial? Your curiosity is really important. That's what will keep you going through the 3 years. And the strapline of the programme, how can I improve the quality of the palliative care my patients receive? People often ask about timelines. The maximum time from the start of the course to submission of the dissertation is 5 years. Run straight through, it's 3 years, but there is scope in certain circumstances to take time out and take an additional year. In very exceptional circumstances, a second year could be taken out, but that's very much with close discussion with us as a programme team. And all that that might do is that it means that you've got little leeway in the dissertation year to have too much time. So the choice of your project is key. But if you decided to exit and then changed your mind after, for example, a postgraduate certificate or diploma, you can then return at any point within the 3 years. For some learners who might have done standalone modules elsewhere, there might be a chance to bring in 20 or even 40 credits of learning from a different university. However, we do need to hear about that during the application process, because we need to match what you've done with actually the assessments that we have on this programme to see whether you could be excused from some of those assessments. So the more information you can give us about the programme design, the level, it needs to be a level 7 master's course, for example, the assessments, the word counts, the learning outcomes, all of that information up front is really helpful to sort that out quickly. So that has been the taught stage, the dissertation year, the 3rd year. The end point is a 20,000 word dissertation, but it arises from a project that you've undertaken during the year, which could be research-based, evidence synthesis, either as primary research or systematic review, or it can be a quality improvement project with some PDSA cycles, at least 2 or 3 PDSA cycles. And we've got a very close process of supervision with somebody from our end, from the Cardiff University end, but also we link you with somebody close to you where you work, or a methodological expert where you work, but we need somebody who can help you bridge that gap between what you've done in the project and actually what does it mean in the real world and in your setting. And particularly for quality improvement work around the world, having a local champion is incredibly helpful. Very often people ask about marking. So how do we do the marking? How can we make sure that if you are in Ethiopia or Australia or South America or India or Bradford or the Outer Hebrides, you're all practicing palliative care in a slightly different way? How can we possibly make sure that the marking is as fair and equitable as possible? And the answer to that is we do that with a marking rubric. All the information is shared, it's available, it's in a consistent format. We have a marker briefing each year. We have university processes and standards that we aspire to. So formative work comes back within 2 weeks. Summative work comes back within 4 weeks. For dissertations, it comes back within 12 weeks. And everything should be very clear. We ask you to feed forward on the feedback that you're given. So we've actually got a community of practice within our marking faculty as well. And the aim of the markers is not simply to give you a numerical mark, which really is that badge mark of a master's programme. 50% is our pass mark, and at master's level, anything above 50 is really a considerable achievement, particularly as you are working at the same time. So you're studying this programme part-time. But we do aim for our feedback to be, again, things which are transferable. So even if you have a high mark, we are asking our markers to really give you some feedback to help you continue to be curious. Why is duloxetine for neuropathic pain considered a little bit more effective than pregabalin, for example, or gabapentin? What's the difference between pregabalin and gabapentin? Where's the evidence been generated from palliative care? When we started using these neuropathic pain agents, much of the evidence came from the diabetes world because of their increased numbers, obviously, of people with diabetic neuropathy. Does that translate into the palliative care world? Well, that's a question for you to be curious about and to wonder about. Now, in 2026, many of our palliative care interventions are very much more evidence-based than they were. But they're not all robustly evidence-based, but we are choosing to accept a particular intervention as best practice. Be curious about that and talk to colleagues about that. So that's really the structure of the programme and the marking and the assessments. But I want to go a little bit deeper into that for the last few slides, really. And just think about what it might gain, what you might gain by following this programme compared with others. We are interprofessional, we are international. There is a real sense now that this collaborative approach to learning and to working and to sharing experience is the way forward. We can all learn from each other. When I interact with my colleagues from different countries of the world, sub-Saharan Africa, India, for example, I learn things which I come back and share with my team. Online, we will be doing that with the programme, but you will learn things about the way that other people practice palliative care that may be incredibly helpful. I don't think there's any part of the world where resources are not under threat in some part or another, so actually this incredible value in learning from each other is important. Being curious about paediatric palliative care if you work as an adult, or adult palliative care if you work as a paediatrician. That can be incredibly helpful for different ways of doing things. We do have the separate modules, but only one separate modules, and we try to bring people together in our online tutorials. But our real aim is for you as a cohort to develop networks to support your professional practice. I studied the diploma in 1994, finished in 1995 because it was a different timeline then. And the people that I studied this course with at that time still remain my professional network. They are the people who I will go to for advice, for discussion. And so we're hoping to really build that expertise around the world, partly again because the role of palliative care, the role of good quality care of people with life-limiting illness is changing, it is developing, and I think there is a need for us as a group of interested practitioners, whether it is as a generalist or as a specialist role, working together, learning together, professionally developing together, I think is important. Many people get to this point in the presentation and then start to feel a little bit wobbly, saying, okay, this is all fine, but actually what happened, what sort of support will you have for me personally as a student? We've tried to incorporate all the designed features in Universal Design for Learning as we've put the programme and the programme materials together. We have a variety of ways that you can access the materials. We've got them online as reading lists, accessing into the library. We have online facilitation and tutorials. We have online discussion boards. You have a personal tutor. You have a module lead. You have myself as program director, and sometimes I fulfill 2 or even 3 of those roles. But there are always people that you can talk with. We ask that people are considering how they're writing. There is a way, if you have got an element of neurodiversity that might affect your academic skills, there is a way that you can report this and let us know, just because then that will make sure that you get feedback and you get support in the way that is right to you. So again, by all means, please drop us emails and discuss these things if you're wondering about this as part of the application. What's useful to know? This programme works best if you are seeing patients with palliative care needs, but this can be in any capacity of healthcare delivery. But to learn this programme, to study this programme in isolation from actually seeing patients is difficult, because the assessment will ask you to reflect on how you've interacted with a patient with palliative care needs. For workshops and tutorials, we will use Microsoft Teams. There is a collaborative function in Learning Central, but we've been using Microsoft Teams and uploading recordings of those tutorials. Ideally, please, we ask people to have their cameras on and accessible to a microphone. And we know that's difficult if you're joining tutorials from the middle of your working day, but in terms of respect for your colleagues on the programme, actually seeing your face to be engaged with the tutorial is important. We publish assessment deadlines well in advance, so your colleagues who've done the programme already, I'm sure, would tell you organisation is key. So make sure you clock when the assessment deadlines are. Try and get to the September face-to-face teaching. If you need extra help, there are lots of extra academic support, writing supports there on Learning Central. And really, writing at master's level, these days with technology being what it is, you can think, well, actually, is it a useful skill? And the answer to that very definitely is yes. These are transferable skills. If you can write and communicate clearly about the topic, that will help you in all elements of professional and in personal lives. The funding is the difficult bit, isn't it? Because any of these postgraduate programs from any university come at a cost. There are sometimes bursaries and grants available from local organisations, from Hospice UK. Occasionally we are successful with bids from scholarship giving organisations such as the Commonwealth Scholarship. Sometimes organisations will part fund your studies if, for example, you might end up doing QI, quality improvement, in your third year, which might then help develop the organisation. So we're always seeking ways to improve our access to funding. We do recognise that this sometimes can be an issue, but there are ways of making the funding more accessible. So there are ways of spreading the cost of the modules, and our fees and finance team will be able to help you to do that. If you look at the maths of the actual hours of learning, it seems an awful lot, round about 16 to 18 hours a week. However, what we'd also like to say is quite a lot of that is actually sort of incorporated into the day job. When you're on ward rounds, going on visits, seeing patients, you're actually thinking and putting into practice a lot of the things that you've read. Inevitably, around an assessment deadline, there will be a little bit of a peak of activity, but annualized over the year, it will settle out. We do suggest to people, if they can, to learn not to work absolutely to the final deadline time, just because so often crafting the assessment, editing it, doing the spell check will take time. As a university, we've been thinking about generative AI and how that will affect how our assessments are structured. And that's why some of the assessments, in fact, are recorded presentations, because that means that we can actually hear from you individually about how you're practicing palliative care, you're developing your projects in your area. We've got a very clear guidance that there are, for the majority of our assessments, generative AI is an option to help you plan your assessment, but it cannot be used to write your assessment. Indeed, if it is used to write the assessment, then that would count as academic fraud, because it's not you as the student who has written the assessment. And there are difficult sanctions for that, the most severe of which is being asked to leave the course and not continue. So again, we are asking you to very much engage with us in how you're using generative AI, if you are using generative AI. The thing about our assessments for this programme is we're asking you to reflect on palliative care skills where you work, and we ask you to tell us where you work. That's the whole point of the course, is actually improving palliative care for patients and families where you work. How does it work where you work? We do encourage people to go that step with the dissertation stage and publish, although there are some aspects of the taught stage module assessments, which can also develop into publishable material. For example, the opinion pieces in the ethics module are very suitable to be developed into short opinion pieces for publication. So we hope that that's given an overview of the programme. What's always really exciting for us at the end of the programme is understanding what is the light bulb moment. As a result of studying with us, what's the unexpected thing that you've learnt that will stay with you for the rest of your careers? And there will be one. It may be as simple as organisational skills. It may be methodology, understanding qualitative methodology. It may be understanding pain pathways again. And it may be communication skills. But what will your light bulb moment be when you study with us? So we have got a LinkedIn presence. We are there on the University Course Finder. We'd be really keen to hear from you if you've got any other questions. We are always looking forward at this point in the year to welcoming new faces to our community of learning, which starts in September of each year. So I'm now going to stop sharing my screen and see if there are any questions or answers that I can help with. So at the moment, I can't see that any questions in the chat, or if there are any questions in the Q&A sessions. But I hope very much that this has been a helpful recording, and we'd be absolutely delighted to hear from you if there is anything else that you would want to know. I'm going to put our email in the chat. And I'm going to put my personal email in the chat just in case there's anything else you want to know. Thank you very much for listening, and we hope to see you in September.